Oh, hey, I wanted to share my expat experience with the Colombian healthcare system. As you may or may not know, I split time between Bogotá, Colombia and Lucerne, Switzerland. I'm an American citizen though. I am and always have been a very healthy person. The only issue I have is high blood pressure, which is out of my control. You can't fight genetics. My late father had it and my mother has it as well, as my grandparents did as well. I found out about 10 years ago that I had this curse requiring me to take what started out as 10 milligrams of benazepril and in more recent years became 20 milligrams. My problem was that while most medications are available in Colombia and Switzerland, benazepril wasn't. And being in the US for a week at a time around 4 or 5 times per year became difficult to guarantee I had enough medicine. I decided to go see a doctor in Bogotá to get a prescription for something new that was available on both sides of the pond. I have a visa in Colombia and I'm required to have something called EPS, which is a combination of their health insurance and their Social Security retirement. It has been costing me 95,000 pesos per month, and it just went up this year to 99,000 pesos. Depending on the fluctuation of currency conversion, that equates to anywhere from $19 to $25 per month. My assistant made me an appointment. The appointment was within a week. I show up at the doctor's office along with my assistant, check in, and I have to pay 4,000 pesos, about $1, which seems similar to what we would call a copay in the US. I then go sit down in the waiting area where there's around 40 or so people also waiting. Around the room are lots of doors. More on these in a minute. In the US, you typically check in, pay your copay, then sit in the waiting room for 10 to 20 minutes until a nurse comes and get you, weighs you, maybe takes your temperature and or blood pressure, then takes you to the examination room where you wait another 10 to 20 minutes for the doctor to show up. Well, that's where things differ here. They announce your name along with a room number. All of those doors around the waiting area and down the hallways beyond the waiting area are numbered, and these are the actual examination rooms. You basically get up and walk to the room, knock on the door, and someone tells you to come in. That someone is a doctor. Every examination room has the same examination bed or table, whatever you call it, that we're used to seeing in the US. But here, there's also a desk and a couple of chairs where the doctor is stationed. The doctor I got spoke decent English and he was familiar with benazepril. He prescribed me something called Diaban, or by its generic name, Valsartan, which is made by Novartis, a Swiss pharmaceutical company, meaning I can get it in Switzerland too. He also asked me when the last time I had a physical was and ended up creating a return appointment for a physical checkup, which was 6 days later. He gave me the prescription papers, which I thought was interesting since you can simply walk into any pharmacy in Colombia and ask for whatever you want, and they'll give it to you. Heck, there's a delivery service that predates Uber Eats and Grubhub called Rappi that delivers practically anything from groceries, restaurants, pet food, toilet paper, and even things from the pharmacy, including prescription medicine without a prescription. So I was wondering why I even needed this paper since he's already told me what the magic drug I will be taking for my high blood pressure is called. My assistant tells me we have to walk 2 blocks down the street from the doctor's office to a specific pharmacy. We arrive and I have to give my name. They give me a number, and again, I sit in a waiting area surrounded by pharmacist counter stations, 22 to be exact. Now this pharmacy is significantly bigger than others I see around Bogotá. My experience with pharmacies in the US are CVS's, Walgreens, Rite Aids, and such, and there are always several people working behind the counter, and there's always a rack of prescriptions that have been filled waiting to be picked up, and it is honestly a ridiculous number of these. My experience of pharmacies in both Europe and Latin America are small pharmacies with just a couple of people working and no other customers in there when you're in there, and no rack of prescriptions waiting to be picked up. If you're an American watching this and you're taking more than 1 or 2 medicines, you're probably overprescribed. Now, I'm not a doctor and I have no idea what condition or conditions you have, but the consensus around the world is that Americans are the most overprescribed country in the world, and the only thing I ask of you is to be very analytical and think about all of this. There's plenty of data available to support what I'm telling you. The US is ranked anywhere from 22 to over 30 for both healthcare and quality of life. You have to ask yourself, why is that? And you have to examine those countries that rank better and again ask yourself why. If you do the research and you ask yourself the right questions, I think you'll come to a proper conclusion. So back to my experience in Bogotá. This pharmacy was indeed bigger than others in the city. I had to wait maybe 10 minutes tops until my number and name shows up on a TV screen with which pharmacist station number I walk to, where the pharmacist fills your prescription while you wait. Now here's where it gets interesting. I'm expecting to pay something, but the pharmacist hands me my medication and sends me on my way. This pharmacy doesn't actually take money. My EPS takes care of this 100%. Also, I'm used to getting a bill from my doctor's office in the US about a month or so after I have an appointment, for the portion that insurance didn't cover. Well, it doesn't work that way here. Your EPS covers your healthcare 100%, and as long as you go to the pharmacies that EPS works with, your medication is covered 100% as well. So let's move on to my physical checkup. I have to bring a pee sample and a stool sample with me. When the previous doctor created the appointment, he told me this, but he didn't give me the little containers for this. My assistant told me that I just had to go to any pharmacy and buy them. It was 1,700 pesos for both of them. That's less than 50 cents. I show up for my appointment with my pee and poo, and they take my blood, and of course, I was supposed to fast for midnight the night before, which I did. Again, my experience in the US was that when I give my blood for a physical, I have the results a couple of days later. So you can imagine my shock when I had the results in email around 4 hours later. And everything was excellent. I'm on the same page as Tom Bilyeu. I want to live forever. So the Diovan valsartan that I was prescribed has ended up working better than the benazepril I had been taking. Colombia apparently has the highest ranked healthcare system in Latin America and also happens to beat the US and Canada. And apparently I can buy private insurance, which would even improve my options better, but I was quite happy with what I experienced. I love my existence in Colombia. I love the people and I love the climate, especially in Bogotá. Bogotá is an incredible city with world-class restaurants. If you ever want to come to Colombia, you should join our community. I have a group where we meet once a month for food or drink, and that group consists of expats around the world as well as locals who speak English. If you like this video, be sure to hit the like button and subscribe to my channel. Thanks for watching.